Hey everyone, today for my persuasive topic speech, I will be discussing racism within the medical field, racism within modern medicine, and the history of this country. The legacy of modern medicine has a dark history of unethical medical practices and discrimination, and I think it's important to shed light on this topic and provide some solutions to this issue. I want to start with a quote from Dr. Martin Luther King. Of all forms of inequality, injustice, and health is the most shocking and inhumane. I will repeat, of all the forms of inequality, injustice in health is the most shocking and inhumane. This is a quote from Dr. Martin Luther King from a speech in 1966. Um, this quote is still relevant today, and it describes the climate of the world we are living in. Um, Imagine walking into a hospital and not being believed that you're in pain. Imagine losing a loved one because of their color, of their skin. For many of people of color in America, this isn't just imagination; it's reality. It's reality for us. Racism in healthcare is a systematic issue. It results in people of different races receiving different levels of care, which leads to worse healthcare outcomes, shorter lifespans, and preventable suffering. It's not just about bad doctors or poor hospitals. It's about the system that has failed millions of people. Millions of people. If you never experienced racism in a hospital or a clinic, I'm sure you know somebody who has. I'm sure you know a family member that has, a cousin, a friend. If you haven't experienced racism in a hospital or a clinic, it's highly likely you've been discriminated against in some way. Discrimination just doesn't stop at racism, and this issue affects all of us. It's important to really highlight what's happening with this issue so it doesn't affect generations going forward. It doesn't trickle down and affect everybody in a different way. I want to transition to addressing the problem, giving you a history of the discrimination and racism within healthcare. Racism in healthcare is not new. It has deep roots in American history. In the 1930s, the Tuskegee syphilis study allowed black men to suffer untreated just so researchers could observe the disease effects. Literally did unethical, unsanctioned studies on black men to study the effects of syphilis on the body on black men in the 1930s. Tortured these men and treated them like they were less than animals. If you fast forward to today, we still see shocking disparities according to the CDC. Black women are 3 times more likely to die from an illness or a disease that's preventable or pregnancy related more than a white woman, no matter how wealthy or educated they are. So, why is it still happening? One major reason is implicit bias, the unconscious attitudes or stereotypes that influence the behavior. There's a lot of negative connotations that are put on minorities, especially black and brown people. People don't value the lives of a black person or a brown person. They think they don't feel pain. They think that they're just a thug or they're just a criminal or like the world could do without them. These are like unconscious bias that a lot of medical people in the medical field have in their head. A lot of elitism is within medicine and the culture of that world. Um, a 2016 study published in the Proceedings of the National Academy of Sciences found that half of white medical students believe that black patients have thicker skin or less sensitive nerves. False beliefs led them to underestimate pain and delay treatment of black patients. This is a real study from a 2016 medical journal that white students training to be doctors truly believe that black people feel less pain than other humans. They truly believe this, which make them respond in less time to a black person complaining to them about pain. This kind of bias is incorrect and is deadly. Now that we talked about what's happening, let's look at why it's happening. Why are these beliefs coming into play? The problem doesn't start with the patients; it starts with the system. Medical education is one of the culprits. Most medical schools do not teach enough about racial disparities or train doctors on cultural competence. According to a 2021 report from JAMA, only about 40% of medical schools have programs that address implicit bias in a serious way. And it's not just education. Access to quality care is another issue. A study by Kaiser Family Foundation found that Black and Latino patients are less likely to be treated at top-rated hospitals. I repeat, Black and Latino patients are less likely to be treated at top-rated hospitals. So they're not even admitting Black and brown minorities to these top elite hospitals. It goes back to elitism. It goes back to having to do with wealth and race disparity and people feeling like they're better than somebody else, or not even wanting to be treated in the same hospital as somebody that's black or brown. And in other words, the problem isn't just bad luck. It's baked into the system. It's created by the system. So what can we do about that? What are some of the solutions? The good news is change is possible, but we have to take action. We have to have these conversations like I'm discussing with you now, and we need to support policies that fight racism in healthcare. The American Medical Association now officially recognizes racism as a public health threat. They're pushing for reforms in medical education, clinical practice, and research funding, but they can do it alone. They need public support. We can also support local health equity organizations, groups that work in underserved communities, and to ensure their fair treatment. Many of these organizations rely on donations, volunteers, advocacy. Something as simple as showing up to a town hall meeting or sign a petition can make a difference. This is an issue that affects all of us, like I stated earlier. Racism in healthcare isn't just a headline, it's a real crisis. It's not just something trendy to talk about. We look at this problem and we have to fight it together. We have to stand up, show up at these meetings, understand who these doctors are, understand who these nurses are, and hold people accountable for how we treat one another. And that is my speech. Thank you.